Welcome back, everyone. Are you feeling some discomfort in your legs? It could be a sign of blockages in your blood vessels. Dr. Yazan Khatib with the First Coast Cardiovascular Institute helps patients find the best treatment options. But first, it is EMS month, and how do you and the staff at First Coast Cardio work closely with your EMS teams and provide care?
First of all, a big salute to the EMS team. Congratulations for a job very well done across all 5 counties. We're very proud. Orange Park, for example, has gone now to 39 minutes.
Oh, wow, that's wonderful.
From door to balloon. The minute the patient with a heart attack comes into the hospital, within 39 minutes, that heart attack is aborted.
Wow.
That used to be a service not even available there 5 years ago. And all of the hospitals are also catching up very nicely. So big kudos and big salute to the EMS team, absolutely.
Now, I alluded that we're going to be talking about some problems with vessels, blood vessels in the legs, causing blockages, but really sometimes those things are a health-related issue, and you do want to talk first about some of the health conditions that we're seeing that are leading up and contributing to these problems.
Absolutely. We're, as we'll show here in a second, we're really living in an epidemic in the U.S. of increasing obesity, and as a result, increasing diabetes. And if you see on the display, in 1990s versus 2000, there was not a single state that was marked in red, and red marks the states with morbid obesity in excess of 25%. If you look at the 2000s, there's very few states that do not have over 25% morbid obesity. If you look at the second display that they'll show us here in a second, you see how diabetes distribution follows very closely that of obesity, and with diabetes come a whole slew of real problems, okay?
And let's talk about some of those problems because they impact your leg and your circulation.
Absolutely. So the process of blockage that affects the legs, PAD, or peripheral arterial disease, as we doctors call it, is a very common process. Depending on who you read, depending on which statistics, it's somewhere between 1 in 7 and 1 in 10. Past the age of 70, it's definitely 1 in 7, even in those who are walking, feeling well. It is not a process that means that we need to fix those blockages in the legs in every patient, but it is a process that leads us to think about what's going on in the other vessels in the patient's body. It's frequently a problem that manifests in the legs first, and then very soon thereafter starts to manifest with heart attack, God forbids, or strokes or things of that nature.
So how do you, assuming that then impacts the blood flow when you have these clots, how do you then get the blood flow moving again?
And first of all, it's not always clots. Many times it's really blockage per se. Clots come at the very late stages. How do you know about it? Most patients who have it are asymptomatic, do not have symptoms, are only detected during a physical exam at the doctor's office when they take off their shoes and their pulse is checked, and then they found not to have a pulse. But many patients develop symptoms such as pain or achiness in the legs when they walk. At a certain walking distance, they have to stop, especially in the calf, sometimes the whole leg, but typically in the calf. And then as the blockage becomes more severe, then those patients start to develop pain even without walking at nighttime. And if things get even worse, in a few patients, there is actually sores and wounds that develop that could be the preempt of a, God forbid, an amputation.
And what are the new techniques available now to be able to resolve those issues?
There has been an explosion in technology. We also have much better medications now. It starts in the doctor's office by reiterating the importance of smoking cessation, by reiterating the importance of cholesterol control, very rigid cholesterol control, weight control, giving the platelets what's called antiplatelets or certain kinds of blood thinners depending on what they need, and that's all under the direction of their doctor, controlling their blood pressure and controlling the diabetes. So that's the first step. There's a multitude of technological advances that we can go over in our next segment, including stents and drug-eluting stents and atherectomies and even bypass surgery for the few who really need it. But the goal now is to, as best as we can, for us to move to minimally invasive repair of those blockages by endovascular techniques. And we'll talk about it in the next segment. We'll talk about that in the next segment.
And so I think really critically you want people to be able to know their body, to manage their health care, to prevent it if it's happening in the first place, but then also be aware. I think sometimes if you get a pain in the leg, you think, oh, maybe I strained it or it's aged, but really to get something like that checked.
Be an active participant. You know, taking care of you as a patient is a team effort where you as a patient is the #1 player. The doctor, the nurse, the assistants, the technologists, they're all part of that team. We do our best, we give it our heart and soul, but at the end of the day, the patient has got to be an active participant.
Well, as you mentioned, we're going to be talking some more about some of the groundbreaking technology that is available and where folks can get it. So we'd like to, of course, thank First Coast Cardiovascular Institute for sponsoring this segment. And as you just said so well, remember to know your body, know your risk factors, and work with your doctors to address them. So if you'd like more information from First Coast Cardiovascular Institute, visit firstcoastcardio.com or give them a call at 904-493-3333. Stay with us. Dr. Khatib is going to be joining us again later in the show, and you do want to stay tuned because they're really amazing new technology that they've got coming up that you do want to hear about it.